Hello, my name is Manuel Pina. I'm studying Health Service Administration at Santa Fe College and taking additional courses for quality management. I've worked in quality improvement for 6 years and I'm the healthcare administration intern in the quality office.
Can you picture going into the hospital and not receiving care due to there not being enough nurses? Understaffing has been a major concern in the healthcare industry even prior to the COVID-19 pandemic. This issue has directly affected the quality of care provided in healthcare organizations around the world and can ultimately lead to larger problems for the population, such as closure of healthcare organizations and an increase of people who do not receive care. By creating a plan to eliminate the possibility of understaffing, we would be able to improve the quality of care provided to patients. Spath mentions it is important to implement a plan that has the proper performance measures that align with the organization's goals, which in this case would be to produce a solution to understaffing. The purpose of this presentation is to inform healthcare administrators of the concerns around understaffing in hospitals, specifically nurses, and the negative impact it has on the quality of care provided. I recommend that the healthcare administrators continue to maintain an efficient nurse patient ratio by focusing on a plan to implement float pools and an adaptive training which helps direct attention on patient demand and reducing errors. In this presentation, I will be identifying the concerns of understaffing in healthcare organizations and the direct correlation to quality. Within this topic, I will offer a solution to this problem and a plan for implementation for these organizations. I will then discuss the benefits of this plan and will have on both quality of staffing and quality of care within healthcare organizations. I will begin by addressing and explaining the problem more in depth.
The problem is that many healthcare organizations are facing a shortage of staff, which affects several outcomes. One example of a time when understaffing had a tremendous impact on a healthcare organization is during the pandemic. The shortage of nurses during the pandemic caused a lot of issues for the nurses that were working at the healthcare facilities. According to the KMOV in the St. Louis area, nurses felt overworked and continuously tried to adapt to the needs of patients. The KMOV explains that these nurses faced issues with a heavy workload as these units reached capacity and couldn't provide quality care to its patients. This issue that nurses face leads to further stress and burnout, which has increased the understaffing problem. As we face a pandemic that we could not control, it put a strain on these nurses that occupied the positions. According to the KMOV, about 10% of nursing positions were unfilled in the state of Missouri, while at the same time there was a 15.2% turnover rate for registered nurses in the St. Louis area. These issues led to the undesirable patient outcomes. Crabtree states if no solution is offered for this problem, it could lead to nurse burnout, high registered nurse turnover rates, low employee engagement, patient dissatisfaction, and poor outcomes. Although staffing was an issue prior to the pandemic, understaffment only got worse and will continue to be a concern unless a plan is implemented to help prevent this in the future and fix the current shortage of staff. The solution I offer will help prepare staff by increasing skills and availability, which ultimately improves patient outcomes. Implementing float pools and predictive hiring will help solve the understaffing problem. This will begin with a two-step approach within healthcare organizations. According to Crabtree, predictive hiring is hiring a nurse prior to another vacating a position, which resulted in a reduction in staff cost and an improvement in staffing by 2.4% in a community hospital in the Midwest. Along with this, floating pools would also allow the available staff to move around to different teams and adapt to different environments. This would allow the staff to learn new skills and would also allow them to cover different areas if shortages ever arise. This step would be the definer for quality improvement in staffing. Spath discusses the importance of performance measurement and quality, which in this case would be internally driven measures that align with the goal. The ultimate goal would to be improve the quality of staffing and care while reducing the shortage of staff. Quality indicators would help measure staff engagement, job satisfaction, and patient satisfaction. By predictively hiring and improving the rotation of staff, the focus on quality improvement increases and helps move those problems. Now that we know the solution, allow me to explain how we can implement it. For this two-step approach, we will focus on how each one of the will bring the organization closer to the goal. In order to implement predictive hiring, there must be a process for the organization to know when a staff will be vacating a position. A study can be conducted over time to find the number of staff needed to successfully care for patients efficiently. Crabtree explains that this staffing model was the best metric to predict staffing needs, and the data-driven staffing will improve patient outcomes and safe patient care. It is important for the organization to have several people who will be able to be hired or interested in being hired if a position ever becomes available. It would be wise to advertise to people who may have just completed or are in college. This would also allow there to be a larger number of people available to fill the position. With these things in place, a process of hiring would be needed to be created so that if a shortage ever occurs, there are people who would be able to fill in. With the staff that is currently available at the organization, a plan to float staff from one department to another would allow them to train and adapt new skills, which would allow them to fill those spots if needed. This plan would begin with creating a list of positions most needed within the departments and using the ratio from before to move staff around to train and work in those areas. Ideally, these positions would be able to be filled and well covered if anything occurs like another pandemic. This would increase staff engagement and also allow staff to find different areas to feel comfortable. Now, with the implementation, we can look at the benefits. By focusing on enhancing staff retention and satisfaction, it positively impacts quality of care given to its patients and patient outcomes. Johnson mentions that staffing shortages are forcing people to endure longer wait times to receive care, even in life-threatening situations or even being turned away. This is the quality of care that organizations should strive to move away from, and this plan would help facilitate that problem and ensure patients are receiving proper care. Johnson also discusses that with the strain on staff, many healthcare workers suffer burnout, which can be seen in a poll from 2021, where 18% of 1,000 healthcare workers had quit their job. Job retention and satisfaction are crucial in any workplace, and this plan helps prevent putting too heavy a workload on the staff. Staff Staffing in the healthcare system has a direct impact on the quality of care and must be improved to advance our healthcare. To wrap this presentation up, improving staffing won't only improve the organization, but also the care it provides for its patients. The shortage of staff has a direct impact on the quality of care and the quality of staff satisfaction. To address this problem, we implement those steps to focus on covering the areas needed and prevent heavy workloads and burnout. The nurse patient ratio will allow organizations to understand what levels of staffing are required and can adapt to the plan to best fit their needs. This will improve the skills and availability of the staff while improving the patient outcomes. I recommend to adapt the predictive hiring process within your organization and implement floating pools to improve the abilities of your active staff. I urge you to evaluate your organization's goals and patient outcomes and review how staffing affects your processes. If we want to improve patient outcomes, we must improve staffing. The quality of care you implement in your organization may be the quality you receive in the future. Here are my references for this presentation.